Welcome back to Bibliodent. Topic is middle ear. We'll discuss parts, boundaries, mastoid area, pharyngotympanic tube, bones, muscles, vessels, and innervation. Middle ear is an air-filled mucous membrane-lined space in temporal bone, and it communicates with mastoid area posteriorly and the nasopharynx anteriorly. Moving on to the parts, there are two, which is tympanic cavity and epitympanic recess. In the figure, you can see that is your outer ear, external auditory canal. The green color is tympanic membrane, and this area is middle ear, where you can see three ear ossicles, malleus, incus, and stapes. This divides the middle ear into two space, that is tympanic cavity, which is lower to these, and upper area epitympanic recess. This is epitympanic recess area. Boundaries. In order to easily remember, I have made a mnemonic which is related to a house. So middle ear has got a roof, floor, anterior, posterior, medial, and lateral walls. Consider it as a cube, and it's in the shape of a house that you're going to build. We'll start off with the roof. Roof, the mnemonic is terrace for tegmen tympani. So on the roof there is a terrace, and the terrace for tegmen tympani. Here the tegmental wall consists of a thin layer of bone, and it separates the middle ear from the middle cranial fossa. So the thin layer of bone is called as the tegmen tympani. This separates the middle ear from the middle cranial fossa, and that bone is called as tegmen tympani. So terrace for tegmen tympani. In the figure you can see there is a roof, and the roof has got a bony structure which is separating the middle ear from the middle cranial fossa, that is tegmen tympani. Moving on to the floor. You're planning to pave your floor with ivory tiles. Ivory tile floor. That is the mnemonic. Ivory, I for internal jugular vein, and T in the tile for tympanic branch from glossopharyngeal nerve. So this thin layer of bone in the floor, it separates the internal jugular vein from the middle ear. That is the reason why it is called jugular wall. It separates internal jugular vein from the middle ear. And then in the medial wall, closer to the medial wall, there is a small opening through which tympanic branch from glossopharyngeal nerve emerges. So that is tile, T for tympanic branch from glossopharyngeal nerve. Ivory tile floor. In the figure, you can clearly see there is internal jugular vein which is separated by the floor, and there is a small aperture closer to the medial wall through which the nerve arises. Now moving on to the lateral or membranous wall. Here lateral code is recess bathroom. Lateral, latrine or bathroom, recess bathroom. So B for bony lateral wall of epitympanic recess. And the major area of the lateral wall is covered by tympanic membrane, while rest of the wall is by the bony lateral wall of epitympanic recess. Posterior or mastoid wall, imagine there is an opening for your cat's house or room there. So C for chorda tympani nerve, there is an opening for chorda tympani nerve on the posterior wall. A for adductus to mastoid antrum. Adductus meaning opening to the mastoid antrum superiorly, and T for tendon of stapedius muscle. There is a pyramidal eminence which is for the tendon of the stapedius muscle. And this wall is the partition between the tympanic cavity and the mastoid air cells. Okay, mastoid air cells and the tympanic cavity is separated by this wall. In the figure, you can clearly see an opening for the chorda tympani nerve, C for chorda tympani nerve. A for adductus to mastoid antrum, and T for tendon of stapedius muscle, which forms a pyramidal eminence on the posterior wall. Anterior wall, as we all know, in the front side of the house, your cars will be parked. So here the clue is indoor car parking tent. Indoor car parking tent. I for internal carotid artery. Internal carotid artery is separated by this thin wall from the middle ear. Then C for chorda tympani nerve. Here the chorda tympani nerve takes the exit. Unlike the posterior wall, from there chorda tympani nerve was entering. Then P for parking, that is pharyngotympanic tube. So there is a large opening superiorly on the wall for pharyngotympanic tube. And then T for tensor tympani muscle. Okay, canal has an opening for tensor tympani muscle. In the figure you can see internal carotid artery is separated by this wall from the middle ear. Then there is an opening for the exit of chorda tympani nerve. C for chorda tympani nerve. Then P for pharyngotympanic tube. There is a large opening for pharyngotympanic tube. Then there is a canal for the tensor tympani muscle. Moving on to the medial wall, imagine on the medial wall of the house there is a prominent arch which is rounded and bulged in nature, and there are two windows, an oval window and a round window, through which you can keep your face in order to observe a beautiful semicircular canal filled with water. Now, this is not necessary for you to remember, but if you want, definitely you can use this mnemonic. Again, the prominent structure on the wall, that is the arch, prominent structure on the wall is a round bulge. It is called promontory, and it is produced by the basal coil of cochlea. Now, there are two windows, oval window and round window. Oval window is postero-superior to the promontory, and it is the point of attachment for base of stapes. Then there is round window, which is postero-inferior to the promontory. Other than that, there are two prominence of facial canal, which is posterior superior to the oval window, above which there is yet another prominence, that is prominence of lateral semicircular canal. Okay, so these are the structures on the medial wall. Now we'll explain it in detail using the figure. Here you can see a rounded bulge, which is your promontory, which is caused by the basal coil of cochlea, and there are two windows, oval window postero superior to the promontory and a round window postero inferior to the promontory. Above the oval window there is a prominence, that is a prominence of facial canal, above which yet another prominence is there, which is the prominence of lateral semicircular canal. Mastoid area, it is posterior to the epitympanic recess of middle ear. This mastoid area is a cavity filled with collection of air-filled spaces called mastoid cells. Now there is a clinical significance of mastoiditis. In middle ear, there is an opening, that is the adductus to mastoid antrum, which connects the middle ear to the mastoid antrum and the mastoid air cells. And the lining of all these are continuous in nature, which is a mucous membrane. So once an infection gets caught in the middle ear, it can easily be transferred to the mastoid air cells, and that condition is called as mastoiditis. Moving on to pharyngotympanic tube, it connects the middle ear with the nasopharynx and equalizes pressure on both sides of the tympanic membrane. We spoke about this earlier, that is, on the anterior wall of middle ear there is an opening for the pharyngotympanic tube. From here it extends forward, medially and downward to enter the nasopharynx. This pharyngotympanic tube has a bony part and a cartilaginous part, and the vessels which supply the pharyngotympanic tube are ascendopharyngeal artery, middle meningeal artery, and artery of pterygoid canal. Venous drainage is into pterygoid plexus, and innervation is by tympanic plexus. The figure, you can see middle ear anterior wall from where pharyngotympanic tube is extending into the nasopharynx. The bones or auditory ossicles of middle ear are malleus, incus, and stapes. Starting with malleus, it's the largest. It has got a head, neck, anterior and lateral process, and a handle. The head, the posterior surface of the head, it articulates with the incus. Then there is anterior process and a lateral process. Anterior process is connected to the anterior wall of middle ear by a ligament. Then comes the lateral process, which is connected to the anterior and posterior malleolar folds of tympanic membrane. So anterior process to anterior wall of middle ear by a ligament, lateral to the malleolar folds of tympanic membrane. Next one is incus. Incus has got body, long and short limbs. Body is where the attachment of head of malleus comes. Long limb, it bends medially to articulate with stapes, and short limbs to the upper posterior wall of middle ear. This is the structure of incus. Stapes, it's the most medial of all three, has got a head, anterior and posterior limbs, and a base. The head articulates with long process of incus, and the base is connected to the oval window of middle ear. We spoke about the oval window of middle ear earlier. This is a figure of stapes. Muscles in middle ear. First is tensor tympani. The origin is from cartilaginous part of the pharyngotympanic tube. I told there are two parts for pharyngotympanic tube, a bony part and a cartilaginous part. Origin is from the cartilaginous part of pharyngotympanic tube and greater wing of sphenoid, and the insertion is into the upper handle of malleus. So from the cartilaginous part of pharyngotympanic tube, it is connected to the upper part of malleus. The innervation is by branch from mandibular nerve, and the function is contraction. That is, it pulls the handle of malleus medially. Next muscle is stapedius, and the origin is the attachment to the inside of pyramidal eminence, which we spoke about earlier, and the insertion is into the neck of stapes. Okay, so origin is from the pyramidal eminence and the insertion is to the neck of stapes. Here in the figure you can see the insertion is to the neck of stapes. Innervation is from the branch from facial nerve, and function is contraction. It pulls the stapes posteriorly. Vessels, numerous arteries supply the middle ear, but major of them are tympanic branch of maxillary artery and mastoid branch of occipital artery. Then the venous drainage is to the pterygoid plexus and superior petrosal sinus. Innervation, tympanic plexus innervates the mucous membrane lining the walls and contents of middle ear. Now this tympanic plexus, it is formed by tympanic nerve, a branch of glossopharyngeal nerve, and branches of internal carotid plexus. That is about the innervation. So that's all. The reference was B.D. Chaurasia. The questions which can be expected is long essay, describe the middle ear under the following heading: boundaries, content, blood and nerve supply, and applied anatomy. Any of these can come in combination as short essay, short notes on tympanic membrane, ear ossicles. It's an important topic in anatomy. Thank you for watching. Do like and comment, save and share, and follow for more. Thank you.